You're tuning into the Active Mom Podcast with physical therapist Dr. Carrie Pagliano, a real mom's guide to all things postpartum return to workouts after baby. If you're a postpartum mom, coach, trainer, or physical therapist looking for answers on how to get back to running, CrossFit, yoga, Pilates, HIIT, you name it, without the fear of pelvic floor issues or doing something wrong, this is the podcast for you. Let's start the show. All right, welcome to the Active Mom Postpartum Podcast. I'm your host, Carrie Pagliano, and today we have another solo episode. We are going to be talking about running in pregnancy. I thought probably the best way to kind of go through this is I have some kind of viewer questions, so to speak, that I've gathered along the last few weeks where we kind of dive into the major topics. I'll probably insert some of my experience with kind of my pregnancies and then some clinical experience as well. And then I've got some references that we can kind of pull in. But I want to start with a little history lesson. And everybody gets upset that we don't have a lot of research in women participating in exercise in pregnancy, whether it be running, lifting, at least we have a couple things now. And I think what's important to remember is, one, it's really hard to get these studies through ethics boards because nobody wants to risk their baby's health, And a lot of the data that exists that looks at exercise in pregnancy is looking at impact on the fetus, impact on birth outcomes, those sorts of things. But in the context of the fetus, not in the context of what does your pelvic floor look like, or, can you run again, like that? Those aren't the questions that were being asked. So that's the first point that I wanted to bring up. And then the second point I wanted to bring up is the fact that we're even asking these questions. And I know those of you who are considering pregnancy or are pregnant now or recently pregnant, you're going to think I'm crazy when I say this, but like, this is relatively new history. I'm not going to lie. My kids, are 11 and 13. And I was probably a pelvic floor PT for about 12 years before I was pregnant with our oldest. And I remember thinking, oh, I'm going to run all the way through pregnancy. I'm going to run right into the delivery room, be super active. And in retrospect, I said that, but I had no details, plan, anything to back it up. Because there wasn't anything. This wasn't anything that we were ever taught. We're just like, oh, just run and see how it goes, whatever. And my first experience was pretty shitty. I'm not going to lie. Like, I ran, I think, up until 19 weeks with our oldest. And I've shared this story before. Like, I got maybe like a half mile from our house. And it was just so much bladder discomfort. And I kind of basically sat down on a rock next to the Potomac River and called my husband crying. I'm like, you need to come get me. I can't even walk home. And that was kind of the end of that. In retrospect, I had a whole bunch of pelvic girdle pain. I really wasn't doing any strengthening because that's not what we did then. There's a lot of things that I would do over again. And then honestly, and of course, when I start recording, they're doing construction. And with our second pregnancy, because it was after a miscarriage, I think I was just so freaking scared and tired because I had a toddler that I really didn't do much of anything other than walk and take him to the playground and work and that sort of thing. So that's kind of my experience. And there's a lot that I see in the rear view that's like, I look at it through a different lens. Like, had I known, this is what I would do now. And no, I'm not going to go get pregnant again just to, prove that. We're in menopause anyway. So all good. But I think one of the first things I ran into with women who are considering pregnancy or are newly pregnant and here's the caveat, and not experiencing morning sickness yet, because you're like, oh, I'm so excited, we're pregnant, and you're kind of waiting for anything to happen. You're like, oh, this is great, I feel great. You're going to be asking those questions because the second that morning sickness hits, you're not going to be asking about running, I promise you. Especially first pregnancy, you're going to be crashed out on the couch as soon as you get home from work and begging for naps and that sort of thing. What we do know, which is good news, is that there's a couple of predictors on what you might experience during pregnancy as far as like musculoskeletal issues. We're not going to go in this podcast into like medical issues like blood pressure, preeclampsia, diabetes, gestational diabetes, any of that stuff. We're going to stick with mostly the musculoskeletal stuff. Um, but yeah, that first little bit of that first trimester when you're just kind of waiting to see if everything sticks, like you're pretty good until that morning sickness comes in. And so you see these questions, and I'm going to give you a couple examples here. Just found out I'm pregnant, currently training for a marathon. I'll be 15 weeks at the time of the marathon, and I just ran an ultra 6 weeks ago. My gynecologist isn't in favor of exercise or running in pregnancy. What should I do? Um, so the fact that number one, we've got women doing ultras, this is totally new. Like, not that many women were doing ultras 10 years ago. So we have to kind of look at the GYN situation and say, okay, is this person familiar with working with athletic females who want to get pregnant and who are getting pregnant? And the fact that this person is like, my gynecologist isn't in favor of exercise or running in pregnancy. So, like, let's just start with the exercise piece. There's nothing, like, absolutely nothing that we know, you know, all like rando medical stuff aside, that says that exercising in pregnancy is bad for you as the mother, bad for the fetus, bad for anything. Like, we've got nothing. Okay. If anything, we're starting to build kind of a stack of evidence to be like, no, actually, it might be good to be more active to help with fetus size and preterm labor and all sorts of things like that. Um, so chances are you already have a gynecologist. If your gynecologist is like, nope, I'm not on board with exercise, I'm not on board with running. This is kind of the beginning of that conversation of, is this who I want to keep fighting for the next 9 months? Um, do I want to take the time and effort to educate this person because I frankly don't have any other choices? And that may be the case geographically or whatnot. Or is it worth, you know, to get out of that situation and go find somebody that actually is aware of the updated kind of evidence, but also understanding that exercise is good for other than physical reasons, for mental health reasons. Like, this is who this person is. Even if you go into the minutia of the fact that she finished an ultra 6 weeks ago, the woman's in good shape. Like, at 15 weeks, if she wanted to run a marathon, I'd be like, you know what? You're in decent shape. If you wanted to PR it, I'd be like, yeah, that's probably not going to happen. But if you just wanted to get through it, keeping an eye on basic medical things, blood pressure, all that kind of stuff, like, I don't see why not. As long as you're not having any pelvic girdle pain, which basically means any sacral iliac pain, back pain, pubic bone pain, hip pain, those sorts of things. But that gets into the minutia of a GYN being like, yeah, totally, keep doing what you're doing. And there are more gynecologists that are kind of hopping on board with this now, which is great. But I have a client that she's expecting twins, and one of the first conversations that they had was like, okay, we don't want you to be doing any lifting, and we need to start discussing C-section. And she's like, is this right? And I'm like, nope, you might as well, find another GYN now. And she's a very active person. So do not be afraid if your spidey sense says, hey, this isn't right, from the get-go regarding exercise or running, don't be afraid to shop around a little bit to find somebody that's going to be conducive, because you don't want to spend the next 9 months like fighting that battle. You got a lot of other things to have to navigate. Don't waste it there. Next thing, tricks to stop nausea so I can run in the first trimester. I miss running. That one's hard. I was really lucky to, both my kids, the nausea kind of settled out at the end of the first trimester, but I do have clients that have the nausea the entire pregnancy. It takes it out of you. And no, I don't know that there's really any tricks. I mean, I had this little kind of perfect bite when I was working at the hospital that I would finish one client a little bit early and start the next one a little bit late. Sorry for those of you that had to deal with me then. And I would go across the street to the little Epicurean and Company. And I would have like a little bit of egg, a little bit of pancake, a little bit of syrup, and don't judge, and a tiny little bit of scrapple. Um, if you don't know what scrapple is, Google it, but don't look at me any differently, please. So I had this perfect little bite that if I had it like right before 9 o'clock, I could kind of get through the next chunk of time and get through the next chunk of time because I couldn't eat big meals or things like that. Like, honestly, I don't remember exercising much during either first trimester with my kids. And definitely, I was super sick during the pregnancy where we had a miscarriage, and I couldn't do anything. We moved during that period of time, and there's still things that I can't find because I didn't do the moving. So no, no tricks, other than wait it out, do as much as you can to feel good, watch, manage food, that kind of stuff as well. But um, another question that came up about that first trimester, I have two kids that are older. I just found out I'm pregnant. I'm running consistently, but I just started leaking and my pad is overflowing. Should I use period undies, pelvic floor exercises? What should I do? I get this question a lot, and I also kind of preempt it with my clients that we've worked through that first pregnancy, and they're like, "Okay, well, I'm thinking about getting pregnant again." I tell them like, "Hey, that first part of your first trimester, estrogen's going through the roof. So we have a huge build in estrogen. I think it continues on past 20 weeks. Relaxin only kicks up to 14 weeks. And I know everybody wants to blame relaxin for everything. It's not it. It's really just estrogen. And so lots of times I will have moms, either that they did not tell me that they were trying, they did not know they were trying, they did not realize they were pregnant, all of those different things come in. And we've been working really closely, on leakage or pressure or pain or things like that. And they're completely symptom free and they're getting ready to get pregnant, like that whole thing. And all of a sudden their symptoms come back out of nowhere. And we're like, wait, what the heck is going on? My money is always on double check and make sure, pregnancy status, because lots of times those symptoms that you experienced before, especially if there's a hormone component, will come back. It'll freak you out. Sometimes that's like that first sign that you're pregnant. So with this particular person, the fact that her pad is overflowing, okay, that's a bit more, disconcerting. We got to dive into that a little bit more, but um, leakage again, if there's more of a hormone component to it, then it's highly likely that those two things are related. And then sometimes it settles out into that second trimester, and sometimes it doesn't. But either way, and this is another kind of fine point too, is gone are the days, at least I want them to be, where you have leakage, you have pelvic girdle pain, you have, symphysis pubis pain, you have round ligament pain, and your GYN is just like, oh, well, this is just what happens in pregnancy. It'll be over in 9 months. No, please go see somebody. Like, all those things are addressable. And, there's a lot of us that are looking at, if we address pelvic girdle pain, if we address some of these things in pregnancy, um, does it make it easier for the pelvic floor to relax during labor and delivery? And potentially, what might that impact be on delivery injuries and outcomes and things like that? So it's always worth it to go. There's a lot of stuff we can do. It's not stuff that you have to suck up and just deal with. So there's that one. Another one of first trimester. I love this one because there's actually some good data here. I'm 6 weeks pregnant. My boob pain is so bad. Suggestions. First of all, estrogen. And any of you that, like, you've gone through, a pregnancy a couple times, like, that boob pain is awful. And I feel really bad, and hopefully she won't listen to this, but my daughter's like kind of entering that puberty stage. She's like, Mom, this really hurts. And I'm like, oh my God, it's stupid estrogen, like estrogen and boobs. Curse you. But there was, let me see if I can find it. There was a study. Oh, they were looking at, um, oh, this is what it was. It was a study looking at prevalence and risk factors for musculoskeletal pain when running during pregnancy. It was a survey of 30102 women, by Wyatt Shear and Hume et al., July 24. And basically, what they were saying, they looked at 23 ethnicities from 25 countries. Women were 22 to 52 years old when they gave birth. Um, they ran significantly less distance and less often during pregnancy than before pregnancy, of course. Most 86% of women had pain while running during pregnancy. 59% was pelvic sacroiliac, 52% was low back, 51% was abdomen, 40% was hip, and 44% was boob pain. Okay. So this poor woman, that first little bit, yes, that's definitely going to be estrogen surge. Lots of times that's kind of your first sign that you're pregnant is you just got this like overwhelming boob pain as I grab my boob. Um, but know that having breast pain during activity is incredibly normal and all these other pains incredibly normal as well. But that doesn't mean again that we have to kind of suck this stuff up. It's let's go back and figure out why this is happening. And breast pain in that first trimester versus breast pain in running, it might just be a support issue. Um, Boob sizes definitely change. I think I went from an A to a C, back to an A, back to a C, back to an A, and then hello HRT, I'm back. I'm settling in at a B. So those hormones and your boobs, they really they're really just tied together. So so perfectly normal, but may want to consider a little bit more supportive bra. So again, referring back to that study, a couple other details. Only 31% of competitive runners that were studied continued to run during their third trimester. Um, and their mean running distance compared to pre-pregnancy was reduced by 23%, 36%, and 45% from the first to the third trimester, which I really find that's interesting too. So, and those that experience pain at any site, they were more likely to report a pre-pregnancy recurring injury. They were older. So older, I older is interesting because I think it depends on where you are in the world. Like here in the DC metro area, my average postpartum client, no joke, is like 38 to 42. So I had one kid before 35 and another at 36, and I kind of feel like a baby. Like it's young for around here, you know? But older, I think airing towards the high 30s, low 40s. Um, and so I thought that that was really interesting. And women who had a previous child were less likely to experience breast pain than those running in their first pregnancy, but more likely to experience pain at the pelvis, hip, knees, and lower back. So that boob pain, it's mostly the first time around, apparently. So I don't know if those of you who have a couple of kids would agree with that, but at least know to expect it. So there's that. All right. Um, so those are kind of the big first trimester things. Typically, how I manage clients in first trimester is if it's somebody that I have been seeing prior to that, um, if there's any sort of acute scenarios that we can address, any quick reoccurrence of, pain or changes in leakage or things like that, we definitely want to dive in and see if we can support it because we don't want them to be uncomfortable or reduce quality of life, especially if you have other kids that you're having to navigate. Um, but it's one of those things that we want to monitor the situation. We wanna monitor the situation, but also at the same time, we wanna be respectful that we want that pregnancy to be viable. And if there are those of you that you've navigated miscarriage, you kinda know what that feels like. It's pretty scary, especially to be pregnant again. And so it's kind of a balance between, making sure that people know that I am there in case something comes up or to ask questions to, but, we may not necessarily want to dive into full on, like, pregnancy rehab or navigating a lot of things if there's nothing going on until that second trimester. So, all right, let's move on to second trimester. Any tricks to minimizing the urge to pee while running pregnant? It starts immediately as soon as I run. That one's tough because the bladder capacity is just reduced. And typically, the further you are into pregnancy, yeah, it definitely does get worse. That was definitely my experience with my oldest. Even if you like try and pee right before you go to the bathroom, like I get to see that quite a bit on ultrasound, real-time ultrasound with clients because you can see that really close relationship because obviously the uterus and the bladder are adjacent. But the fetus kind of starts using that bladder for a little bit of a cushion, a little bit of a pillow. And if there's not great capacity, it can get really uncomfortable. And not everybody navigates this. And I think this is the really tricky thing about pregnancy is you might be that person that you're able to, go all the way through third trimester and not really have any discomfort from the bladder. But you might get to second trimester and be like, hey, I'm, 15, 16 weeks and I'm done. I can't do this anymore. And we don't really have good predictors on that right now. We're starting to get a little bit of information as far as like predictors for musculoskeletal pain and leakage and things like that. And some of them are sort of no brainers. Like if you had back pain or pelvic girdle pain before pregnancy, you may be more likely to have it during. If you have it during, you're more likely to have it after. I think the same holds true for leakage. Um, but again, it isn't always true. So I think it's one of those things that like it's kind of like parenting. You do the best you can with the information that you have and see what happens. Um, but as far as minimizing urge to pee, lots of times that's just going to happen because that bladder capacity is reduced. What we want to make sure of is you don't get in the habit, especially in postpartum, of continuing that urgency frequency, especially if there's no pathology or reason to kind of do that. So yeah, that's a tough one. Another one here, 15 weeks and round ligament pain around the hip and pelvis is making running uncomfortable. Is it too early to start wearing a belly band? And should I wait until I really need it? Are there strength exercises that help? I see this one coming up a lot. And it's tricky because lots of times when people describe round ligament pain, I think they're actually describing like symphysis pubis pain, which is that pubic bone that comes together in the front. There's ligaments across it. Sometimes, as basically again that pelvic ring is trying to open up and get ready for delivery. Those ligaments are getting a little bit more loose. Those poor little hip rotators and muscles on the side are working, over time to make sure you're staying stable. There can be some shift at the front, and that can be uncomfortable. Um, that is definitely different than round ligament pain, but I think people kind of get their definitions mixed up. Round ligament pain, and this one's tricky too because I don't actually know if it's the round ligament. The round ligament is a ligament that attaches between the uterus and the pelvis. Ligaments don't contract. So jury's still out. If anybody has some thoughts on this, please let me know. Um, what I will say is there's a couple different types of pain that you can experience. What I kind of refer to as round ligament pain or recognize as that, call it what you will, is you have the intention to move. So for example, you have the intention to go sit to stand and then walk. And then you kind of get caught with this like gripping pain bent over, and you have to take a couple steps and then it kind of eases up and then you can go again. That's very different than pelvic girdle pain or sacroiliac pain or symphysis pubis pain, that sort of thing. And you can differentiate it a little bit by some quick testing, but also understanding the kind of the scenarios that these symptoms show up in. So, for example, typically sacroiliac pain, which is kind of in the back with the sacrum and the pelvis bone come together, tends to be on one side towards that bone that sticks out in the back. Pubic symphysis pain tends to be towards that pubic bone in the front. It can kind of refer to one side or the other. Typically, those things are going to be pain with single leg or asymmetric activities. So going up and down stairs, getting in and out of the car, rolling in bed, standing on one leg or weight shifting or things like that. Those tend to be the positions or the activities that bring on those types of discomfort. So that again is very different than like a sit to stand, because sit to stand is very symmetrical. You're standing on both feet. Um, we will assess for symphysis pubis issues by testing, can we reproduce the pain by squeezing both legs together or spreading both legs apart, or pulling one leg in or pushing it out? Does that reproduce the symptoms? And quite often um, you'll find women that when they have that pain in the movement, they'll do a quick breath hold to try and stabilize or get through that pain because it's uncomfortable. And what we actually need to do is go back and find some deeper stability. And so sometimes we can find that through breath strategies and finding deep abdominals and transversus. Sometimes we find it through bracing or supports. I'm a huge fan of the Recore Fitness Fit Splint. So that's Celeste Goodson's. She has a maternity one and a postpartum one. It's a really nice, big, wide, I should have grabbed it, band that will go above and below the belly, but provides some nice compression, but doesn't dig into the bottom of your belly. It's not so narrow that it slides up and down. Back in the day, all we had were like Sorolla SI belts and super not comfortable. Um, and you could get it on and stay put, but you couldn't move in it because it would kind of ride up too much. But those belts can be incredibly supportive and just providing a little compression. So if you're doing exercises and it's not quite enough, using one of those belts can be incredibly helpful and supportive. And if you're still having issues, obviously it's super important to chat with a pelvic floor physical therapist because again, if we're having a lot of pain, could that potentially lead to some high tone in the pelvic floor? Could that potentially lead to difficulty relaxing the pelvic floor during labor and delivery? We don't know. These are some hypotheses, but I don't want to, I don't want to find out if I don't have to, Um, and also just having gone through that myself, the quality of life is really crappy. You shouldn't have to be uncomfortable. And the hard part about a lot of those pelvic girdle symptoms is you can kind of correct them, so to speak, or find that stability or whatnot, but you have to keep going with the exercise because, you could step into a hole and then everything is quote off again and it, is uncomfortable or things like that. So it's finding not only the exercises and the strategies to help kind of keep you symptom free, but having that person on speed dial that you can call up and they can kind of provide that manual support or treatment for you so you can navigate pregnancy as with as little pain as possible because I've had clients that unfortunately like had really, really severe SPD during pregnancy and postpartum that they were on walkers and things like that. And it really screws with your mental health. I'm not going to lie because, you're told that this is supposed to be the most wonderful time in your life and you're supposed to be active and happy and healthy and you feel like shit and you can't go anywhere and you can't do anything and you feel like a million years old and you're supposed to take care of a baby and you're like, okay, this is not going to happen. So definitely have a pelvic floor PT in your back pocket that can navigate this. I do find some orthopedic PTs are pretty good at navigating this. These are very straightforward orthopedic problems. For some reason, no offense, orthopedic PTs, y'all are afraid of touching pregnant women. Trust me, you cannot touch us anywhere in our bodies and put us into spontaneous labor. Had I known how to do that, I would have done that with both kids that went to 41 and a half weeks pregnant. Couldn't do it. So, but yeah, so if you're that person that you've got resources, go pelvic floor PT first. If you don't have one locally, um, definitely worth finding an orthopedic PT. But here's the other thing too. Um, Again, with a good diagnosis and awareness of, hey, this is what this is doing. If you can, even if you have virtual access via telehealth or a virtual consult with a pelvic floor PT that's good at kind of helping you with that diagnostic, even just finding out what movement strategies and basic exercises that you can do and soft tissue mobilizations, that's a whole nother way to be able to get some self-treatment and with some good results. I'm a huge advocate for virtual therapy and telehealth services, having grown up in an area that it was 70 miles to the nearest like major reputable hospital. So, if people, they shouldn't be limited by kind of where they live in the world and what kind of care that they get. But I will get off that soapbox for now. So anyway, the whole point of that was if you think you have round ligament pain, you might actually have some of these other things. I think people kind of use them interchangeably, and I don't know that that's necessarily the case. So whenever people ask about round ligament, I'm like, well, actually describe to me what's happening, because it's pretty easy to differentiate, pain standing on one leg versus going from sit to stand, which is very symmetrical. Let's talk about. Oh, this one was good. How can I improve my running at 23 weeks pregnant? This is my second pregnancy. I've never gotten back to my average pre-pregnancy pace since having my first child. But before getting pregnant again, I was doing really well. Ran in the beginning part of my pregnancy. I got COVID and didn't run for 2 weeks, and now I can't run. And I want to be able to run without having to walk. So how do I improve my running at 23 weeks pregnant? Okay, getting this question come up a lot because women are getting illness during pregnancy. That's not a pregnancy question. That's we have to navigate this medically. Sometimes post-COVID infection, there can be post-exertional malaise, meaning you're not recovering well from exercise and exertion. So medically, that needs to be ruled out. And gradual return to exercise over a couple months period of time isn't a bad idea. Um, but again, like to expect to go right back to running after major illness and not being pregnant, that's not something I would expect. Being able to do that and being pregnant as well, definitely wouldn't expect that. And definitely wouldn't want to look at this as, okay, I'm going to improve my running. Let's just start with walking, make sure medically, heart rate, pulse, blood pressure, all that stuff is good. And that may be as far as you get with walking. We may not get back to running. And here's the thing, things happen. You get medical issues that happen during pregnancy. This doesn't mean that that's it for the rest of your life, and I think that happens a lot, especially if you're really, really used to being active and this is first pregnancy. And you're like, "Oh my gosh, I'm not able to run or I can't run to that capacity that I was doing before. Am I losing fitness?" No, stay as active as you can, but this is a very different body. You deal with postpartum when postpartum comes. It what happens in pregnancy doesn't automatically dictate your level of activity or your ability to have success with activity and postpartum. And a lot of people think that that's the case. Like if you can't be active in pregnancy for a variety of different things, it doesn't mean your baby's doomed. It doesn't mean you're doomed. It doesn't mean like you're never going to run again. That's just what that is in that moment. And I think that needs to be kind of emphasized because we think that, okay, this is it. My baby screwed, my life screwed, all this stuff. No, it's just an unfortunate situation. Try and stay as active as medically possible in that period of time. And then once you have your happy, healthy baby, then you kind of start over again and figure out kind of what the next best path forward is in that moment. So do not look to pregnancy as a time to improve your fitness. Do not look at pregnancy as a time to hit a PR. Do not look at pregnancy as a time to prove anything because I talk about it like a sandhill. Like it's kind of like you're taking 3 steps forward and sliding 2 back. Like your job is to whatever body shows up each day because you're literally in a different kind of center of mass, center of gravity, different size, body image, all of that. Do the best you can with what shows up that next day, and then you'll deal with the next day after that and the next day after that. And I think if you look at that way, it's a lot more manageable because you don't know what's going to happen. You might feel great today, and then tomorrow, all of a sudden, you're having SI symptoms for a couple of days because you have a temporary surge in estrogen, and then maybe a week later, you're back to being good again. And that kind of brings up another thing. I was talking to ultra runner Sophie Power. If you haven't heard her on the podcast, she was excellent. She's had a couple of kids. She's famous for being that ultra runner who I think it was during UTMB, Mont Blanc. She was breastfeeding her oldest in the middle of the race. And the backstory is she couldn't defer it. And so she's like, all right, fine. I don't want to lose my spot. Let me just go run this thing. And so she's gone on to do some amazing things to help support moms in races and get race deferrals and that sort of thing. She talks a lot. She did a video with Hoka during her third pregnancy, and she was working with Emma Brockwell, who's an amazing physio in the UK. And they were talking about, she was doing really well running, and then all of a sudden just had a week where she's like, I'm not feeling good. And I think historically we would look at that and be like, oh, no, that's it. Can't run anymore. You're going to have to walk the rest of the pregnancy. And she kind of took the week off. And I think it was like somewhere maybe like 23 to 25 weeks. I can't remember. Took a week off, kind of backed off. And then a week later, she was back to kind of, what she had been doing prior. It was just kind of this little blip. And I don't know that we've looked at exercise and pregnancy this way. And I've really sort of changed my biases, I guess, on, oh, you hit that first sign, we need to back it off. This is it. What if we just look at this as temporary and again, look at it day by day and see what shows up? And does it allow us to actually continue to be more active further along in pregnancy if we don't shut it down sooner? And I think, again, it depends on the temperament and, how those symptoms are and level of risk and all that kind of stuff. But like, I think, and again, we don't have data on this, which hopefully someday, it's up to us as clinicians to ask all these crazy questions and then researchers to figure out how to, make this happen and measure it and so on. But how we look at navigating exercise in pregnancy, maybe we don't shut it down. all at once and be like, all right, this is it. Maybe we look and see, like, all right, well, let's see what this week looks like. And let's see what this week looks like. And I've been able to more recently, I would say in the past probably year or so, not shut it down. With a lot of patients, and I think again, it's going to impact quality of life. It's going to impact mental health. There's got to be some sort of physiological positive outcome of this, but just something to consider. Not only if you're, a pregnant mom, but if you're a physio listening to this and you're like, hey, I used to shut it down. Maybe not. Maybe we kind of just see how things go and consider that there might be estrogen surges or other hormone surges that might be influencing symptoms that are temporary. So, food for thought there. All right. Couple other, and then we'll dive into a little bit more research. Is it okay to run a half marathon at 35 weeks? Um, maybe. I don't know. Depends. What I will tell you is there are far more women considering running half marathons and marathons in pregnancy than I have ever seen. I think back when I had my kids, like I said, they're 11 and 13. I think you would have been shunned within an inch of your life if you were doing that. I mean, we were shunning women in CrossFit and again, it wasn't that long ago that we were telling women not to do marathons because men thought that their uterus would fall out. Like that was only in the 70s, that was within my lifetime. So I think the fact of the matter is we just don't know. It depends on each individual situation. So to go back to the first question that we had, have a team surrounding you, one that supports what you do and understands what you do. And I think probably to some degree that's geographical. I've talked to a lot of ultra runners that live out, California, Colorado, Oregon, that their GYNs also are runners and they get it and they understand the lifestyle and they're much more kind of open and aware. And just informed, I guess, and more likely to kind of be like, yeah, this is kind of normal. If you're doing it before, keep doing it. Obviously, all medical stuff aside, we don't really have anything that says you shouldn't be doing this. We've had how many women compete in both the Olympics and the Paralympics pregnant? CrossFit Games this year, there's a couple women that were like, "Yep, I was pregnant, by the way." We just don't know. So at the end of the day, what I always say is the short answer is it depends. But really, what it comes down to is that decision that you make between you and your team. And please have a team that supports you, your OBGYN, your pelvic floor physical therapist, your coach, your trainer, whatever that looks like. But yeah, I mean, again, I wouldn't just assume that's a gimme, but at the same time, and I wouldn't go for a PR either. That's just me. But I think if you have a level head about it and you're like, "Hey, I just kinda wanna do it just to do it. I'm not trying to prove anything. I'm happy to walk or, I'm happy to step out if I'm not feeling well." Like, yeah, I think these things are totally doable. I do see a lot more women asking questions about, hey, what gels should I be taking? I don't want to have, gestational diabetes. And, is it okay to do element electrolytes and kind of all that stuff? We still don't know. We're trying to figure this stuff out. But the fact that women are asking the questions about fueling, super important, again, because we also don't want to set women up for bone stress injuries and relative energy deficiency, those kinds of things. So the fact that we're having those conversations are really cool. One, because they're really smart questions, and two, because women are active and trying to get it right. Which again, this is really young history. This is 5 years ago. I don't know that we were asking this as readily, and definitely 10 years ago, this wasn't normal everyday conversation, or at least in my world. So all right, last question I have here. How many miles per week or days per week are you running while pregnant? I always shut this one down because I don't think you should be asking that anyway. Okay. Stop the FOMO up front. I don't ask that. The only reason I ever ask that of patients is just so I can get a sense of what their frequency is of activity. I don't frankly care what their mileage is. I use it as a reference point. I'm not using it as a point of comparison. And especially if you're new to pregnancy, there's no prize at the end for best pregnant mom ever. There just isn't. Or if there is, I never got the award. Um, do the best you can. Again, with every day that shows up, and your pregnancy is your pregnancy, just like your kid is going to be your kid. One pregnancy is going to be completely different from your next pregnancy, just like one kid's going to be completely different from the other kid. And the only way you figure out how to be an expert in yourself is to pay attention and figure out what works for you. And that's going to be the right answer. And surround yourself with people that will support you in trying to navigate that as best they can as well. All right. So those are the questions that I have. Um, I want to kind of just dive through real quick. I'd hope to kind of pull in some of these references as we were going, but I'm happy to kind of circle back around and just a couple of articles that I think are important to kind of understand. Again, we don't have a ton of information here, um, but some things that we do kind of again, it's where research is kind of confirming what a lot of us already knew from kind of practicing in this area for a long time. We had Jenny Bagwell on the podcast earlier this year, and she had a paper back in February looking at running biomechanics are different during and after pregnancy compared to females who have never been pregnant. Um, if you are in this space, or if you've ever seen a pregnant woman run or a postpartum woman run, you're going to be like, yep, and like, of course. Um, but some really kind of interesting things. I mean, in general, pregnant women tend to run very vertically, a lot of vertical displacement, not a lot of trunk rotation. Her paper, they found there was greater erector spinae activation. Those are those big back muscles during pregnancy, and it might be potentially associated with low back or pelvic pain. And we already know from the other study, it's pretty common to have back or pelvic pain. She also found significantly decreased trunk rotation at all time points, which might potentially be serving to keep the growing abdomen closer to the base of support during running and reduce the momentum of this segment and improve postural control. Basically, throw the kitchen sink at the trunk to protect the baby at all costs, and you're not running very much, but you're moving your arms. And we tend to see a lot of that in postpartum, but guess what? The fetus is gone, and there's still a lot of that kind of lockdown there because that's what you're used to doing. And so I see so many women in postpartum that kind of, and you can probably relate to that, those women that walk in postpartum like they're pregnant, those women that run in postpartum like they're pregnant. And so you kind of have to go back and retrain that kind of sense of where you are in space. And the fact that you do have the ability to rotate now, and we need to access it and we need to train it. And again, we weren't looking at any of this, 10, 15 years ago. We're like, oh, pelvic floor, that's it. I'm like, no, we need to kind of look elsewhere. So the other thing in the Bagwell study, they were prior to controlling for running velocity, there was decreased duration of gluteal activation with running during pregnancy. So not using your glutes very much. But when adjusting to the variability due to running velocity, there was greater glute med activation during stance and swing. They might be running more slowly to decrease demand on the glutes. So running slowly to kind of help support the activity and not overwork. Yes, pregnant women run more slowly. Although there are some professional pregnant women that run faster than I run in non-pregnancy. But what they did find is there were no significant associations between, wrong study, moving on. But yeah, back to kind of like the gait and things like that. We notice these things in pregnancy. I'm not going to try and change it in pregnancy. Where we'll address it is in postpartum. Any of you that have been pregnant before, you know that your rotation is limited, especially in your trunk, because that baby's basically taken up residence, and there's not a lot of motion in that lower thoracic and lower and lumbar area. And then again, because the breasts are so much bigger too, that diaphragm is kind of shoved up. Those ribs are kind of open a little bit more. There's a lot of restriction kind of that upper trunk as well. So all those things, yes, this is what's going to happen in pregnancy. Totally normal. We'll take a look at it on the other side and see if it needs addressing. Okay. Other study I was looking at, Byberg, associations of physical activity and weight gain during pregnancy with pregnancy-related pelvic girdle pain, retrospective cohort study. This came out July 2024. I thought this was interesting because I have patients all the time. They get shamed on their weight gain, and I'm a little sensitive to this. I think I gained around 40 for my oldest. I gained a lot with my second, probably close to 60. Granted, we had the pregnancy in between, I didn't lose that weight. The story I always tell is, I think right before my daughter was born, I hit 199 pounds, and my husband's like, "Go for 200, you're never gonna be there again." I'm like, "Challenge accepted." Um, I hate that we're taught, "Oh, you need to stay at that, 20, 25, 30 pound weight increase." I was healthy during pregnancies. Could I have been a little bit more active? Sure. Again, that wasn't the culture at that time. Um, yeah, I definitely had pelvic girdle pain. Was that related to being heavier during the pregnancies? It's hard to say because I also had predisposing factors. I had an SI injury from a workplace injury back when I was a young PT. So I already had some kind of predisposing factors. So for me, I'm interested in these things because it's stuff that I kind of had to navigate. This particular study, they said there was no significant associations between physical activity before pregnancy and pelvic girdle pain trajectories were found when they adjusted for other pre-pregnancy variables. And they said exercising 2 to 3 times a week was not significantly associated with pelvic girdle pain. So great, let's exercise. They did say a higher BMI increase during pregnancy was negatively associated with being pain free and positively associated with more severe pelvic girdle pain. So am I going to use that to tell somebody and weight shame them when they're pregnant? No, I'm not going to do that. What I am going to say is if there's a concern that correlates with pelvic girdle pain, I'm also not going to put them on a diet during pregnancy. You're not going to do that either. But we have this information. If there is a concern about weight in pregnancy and pelvic girdle pain, we have that discussion, but then we also talk about how to manage it. There's going to be ways to navigate it that don't involve weight loss because obviously you're not going to do that. So, I bring that up again because that's a question I get a lot. That's something that I sort of navigated. Um, if you're that person that feels like, "Oh, I need to hit that 25 and I'm gonna limit myself food and activity wise so that I stay there," okay, we need to have a conversation about that because I don't know that it's yes, we have this one paper that says maybe, but again, one paper is not a commandment. It's not carved in stone. It's just, okay, let's use that and kind of make our decisions informed, but not, you know, this isn't the law. So all right, let's see what else I got here. Um, the last one, I think, because we already talked about different types of pelvic girdle pain in pregnancy. The last one I have, this one was interesting. Pregnancy-related pelvic girdle pain affects balance in the second and third trimesters of pregnancy. This was, I'm going to say this totally wrong, Hervatin, Hrvatin, in March 2024. And basically, this was a smaller study, 63 pregnant women in age 30 years. Women with pregnancy or pelvic girdle pain demonstrated poor static stability compared to pregnant women without pregnancy pelvic girdle pain, especially in the third trimester of pregnancy. They noticed impaired proprioception, so kind of where your body is in space, and difficulty perceiving body position when they had pelvic girdle pain. And they might be at higher risk of falling, which is really interesting. So if you are a runner in with pelvic girdle pain, you might not know where your body is in space, which I can totally relate to. And I thought this was really interesting too. People with pelvic girdle pain rely more on visual cues for movement planning and trunk stabilization. A lot of this stuff really informs kind of what I look at in postpartum. So if you had pelvic girdle pain in pregnancy, and let's say we did not see each other until postpartum, when I do the return to run readiness screen and I'm looking for balance, I also check with eyes closed because it lets me look at, what's going on with your vestibular system, with your foot and ankle strategies. We do know we have estrogen receptors in your vestibular system and your tendons. If I take away the thing that works the best for you, which is vision, are these other systems not doing their job? And so again, if you have somebody that's navigating pelvic girdle pain in pregnancy, yes, we need to work on that so that there's, do reduce risk for falls. But let's take that information and we want to make sure that we don't miss this in the context of rehabbing in postpartum. But I know people don't really think of pregnant women falling. but we don't want them to fall. We definitely don't want them to fall. So if you are working with somebody who has pelvic girdle pain or you have pelvic girdle pain and you notice that your balance is off, definitely something worth checking out. So, all right, that's what I got there as far as kind of questions and a couple dabbles into the research, a little trip down memory lane in my pregnancy. But I think the big takeaways are we have a society right now, at least here in the States, that is far more active in pregnancy. There are a lot less, I think, social barriers to being active. I can't speak for everywhere, but at least here, I think there's a lot less shaming than even a couple years ago in so many sports. Instead of people being like, oh, you're going to hurt your baby. Don't get me wrong. That's still happening. Talk to Steph Rothstein, talk to, Annie Thora's daughter, any of these people that have publicly navigated pregnancy as a professional athlete. But I think for the most part, kind of in an informed, you know, community, there's a lot more acceptance and support. I think we're getting further as far as research guiding what decisions that we can make, not only with medical issues, but in the musculoskeletal realm. I think we are hopefully moving further past, oh, you have aches and pains during pregnancy. Oh, this is just how it is. Like, definitely address it. Talk to somebody. Have somebody before you get pregnant, so you have that person on speed dial. I that's what I really love. I think about working with women is I've had women that I treated them for pelvic pain before they got married, and were having sex, and then I worked with them during their pregnancies and in their postpartum, and just to be able to kind of work on that continuum where I know their history, they know they have kind of a teammate in me. We plenty of patients that I work through subsequent pregnancies. And, even now we're navigating into perimenopause and menopause. Like, ideally, that's kind of the dream, is that you have that provider that understands you and your kind of physical capacity and your challenges and your goals, and is able to kind of partner with you and keep pulling in those team members as you need them, kind of moving through all these different phases in life. And I don't know that I know I never looked at having a career like that. I know that's not what I was taught that PT was, but that very much is what it's turned out to be, which is super cool. So if that's not a relationship that you have with your providers right now, definitely DM me, let me know. I have a lovely community and network of people all over the world that I'm happy to connect you as best that I can. If you're local here in the DMV area, DMV is not where you go to get your driver's license. It's DC, Maryland, Virginia. If you're in the DMV area, I'm here in Arlington, Virginia, but I also do out-of-state consults and telehealth and license in a couple other states. So definitely hit me up. And happy to answer any questions that you have. I think half the battle is just like having somebody that you can ask and be like, hey, am I crazy for thinking this, or am I crazy for doing this? And I would much rather that you ask somebody that, I don't know, medically they have some professional background in this, than throw up, weirdo DIY Facebook groups and be like, hey, what do you think? And then you've got somebody that really doesn't know what they're talking about giving you medical advice. I don't support that. Which is why any Facebook group that I'm on, I'm like, hey, I'm pelvic floor PT, happy to help. I can find you a therapist. Let me do what I can. Yeah, there's so many of us now, and so many of us are running informed, and we're happy to help and so on. So anyway, if you have questions, definitely hit me up in the DMs on Instagram at Carrie Pagliano. If you're not an Instagram person, definitely feel free to email me and be like, hey, I listened to the podcast. I have some questions, and I'm always happy to help, or at least point you in the right direction of resources that might be appropriate in your area. Carrie at carriepagliano.com. And if you're pregnant, congratulations. If you're thinking of getting pregnant and diving down the rabbit hole, good luck. If you've already navigated a couple pregnancies and not sure where to start, definitely check out. We've got a couple episodes looking at kind of when to exercise in early postpartum, and when is it the right time to start running in postpartum as well. You want to check out those solo episodes. And of course, I think, gosh, we're almost at 55,000 episodes. I'm sorry, 55,000 laws on, oh gosh, what do you call it on podcasts? Like, people have listened to it 55,000 times, which is good. And we've had some amazing guests. I think we're up upwards of 130, 140 episodes of some really cool researchers, athletes, and so on. If you have any requests, definitely DM me as well. I think that's it for now. If you have any ideas for other solo episodes in the future and things that you want to hear about, let me know. Until then, keep staying active, and thanks for joining me. Did you enjoy the podcast? If so, leave us a 5-star review on iTunes and tell a friend to do the same. Are you a postpartum mom or postpartum pro wanting to know more about getting back to running after baby? Check out all my free goodies on carriepagliano.com. This podcast represents the opinions of Dr. Carrie Pagliano and her guests to the show. The content should not be taken as medical advice and is for entertainment purposes only. Always consult your healthcare professional for any medical questions.